Welcome to The Explainer. You know, the marketing around low T is literally everywhere these days, and honestly, it can be incredibly confusing. We constantly see these sensational ads promising quick fixes for aging, energy, and muscle loss. But testosterone, it isn't just about bodybuilding. It's a fundamental metabolic driver that affects nearly every system in your entire body. So today, our goal is to cut through all that noise and get straight to the clear, calm medical facts. We're going to look directly at what clinical guidelines actually say about this powerful hormone and help you figure out if testing is something you truly need.
Okay, let's dive into this. Here is our roadmap. We'll be covering the role of testosterone, who should get tested, how the test actually works, decoding those test results, treatment and natural approaches, and finally, next steps and specialists. Starting with Section 1, the role of testosterone. I want to begin by challenging a really common myth right out of the gate.
And that myth is the idea that testosterone is exclusively a male concern. Actually, scratch that. It's way more nuanced. Yes, testosterone is indeed the primary sex hormone in men. It's mostly produced in the testes, and it controls sex drive, sperm production, and muscle mass. But, and this is a big but, women also naturally produce it in their ovaries and adrenal glands. In fact, healthy women actually produce more testosterone than estrogen on a day-to-day basis. It's just in vastly different proportions than men. For women, it plays an absolute crucial role in energy levels, bone density, and overall health. The big takeaway here is that abnormal levels, whether they're way too high or way too low, can cause real, measurable health problems for everyone, regardless of sex.
So, what happens as we age? Well, starting around age 30 to 40, men experience a natural, gradual decline of roughly 1 to 2% per year. Think of it kind of like a slow leak in a tire. You barely notice it day by day, but over a decade, it fundamentally changes how the vehicle handles. It's a natural biological process, but when levels drop too low, it becomes a clinical issue. Interestingly, the data also links low T to conditions like type 2 diabetes and alcohol use disorder. Now, for women, levels naturally drop too, especially after menopause. Though ironically, it's usually an excess of testosterone in women that triggers a medical investigation. Moving on to Section 2, who should get tested? Let's talk about identifying the specific symptoms. We need to figure out who actually needs to undergo testing based on physical symptoms, not just because you happen to be getting older. And this brilliantly illustrates how those symptoms look incredibly different depending on your biology. For men, doctors are looking for a specific set of red flags: a noticeable drop in sex drive, erectile dysfunction, infertility, or a deep, unexplainable fatigue. For women, the triggers are quite different. Testing is usually ordered if a woman experiences excess body hair, irregular periods, severe acne, or signs linked to conditions like polycystic ovary syndrome, or PCOS. It's also worth noting that age isn't just a factor for adults. A doctor might order a blood test for boys if their puberty falls outside the typical 9 to 14 age range. Testosterone acts as the primary trigger for major developmental milestones in boys, which is exactly why pediatricians watch this timeline so closely. Early or delayed puberty can be directly tied to abnormal levels and definitely warrants an investigation. All right, Section 3, how the test works. Let's get right into the actual clinical process. Because what happens in the lab is actually fascinating. Not all testosterone tests are the same. You'll usually see two terms on a lab report: total testosterone and free testosterone. To picture the difference, think of total testosterone as your overall net worth. It's all the money you have, including what's tied up in a house or investments that you can't easily access. A huge portion of your hormones are bound to proteins, meaning they're inactive. This is the most common test. Free testosterone, on the other hand, is like the actual cash in your wallet, ready to be spent by your cells right now. Doctors rely on the total test first, but they'll specifically order the free test if they suspect your binding protein levels are abnormal. So what does the testing protocol actually look like? Step 1 is a morning blood draw, specifically between 7 and 10 a.m. Why 7 to 10 a.m.? Because your hormones are early risers. They surge in the morning, just like rush hour traffic, and taper off later in the day. Timing matters immensely for an accurate reading. Step 2 is lab processing, which usually takes about a day. And Step 3 is absolutely vital. You must confirm any abnormal result with a second, separate morning test. A single night of bad sleep can completely tank your morning number, so one low reading is never enough for a definitive diagnosis. I also want to calmly warn you about at-home testing kits. While doing the saliva swab or a finger prick at home is incredibly convenient, the medical consensus is clear. They are generally less accurate than a standard venous blood draw done in a clinic. If your at-home kit shows an abnormal result, you're almost always going to need a clinical blood test to confirm it anyway. Now for Section 4, decoding your test results.
let's make some sense of the numbers.
Now, what's really interesting here is the stark contrast in the baselines. For adult men, the generally accepted normal range is about 264 to 916 nanograms per deciliter. For adult women, it's roughly 15 to 70. But please keep in mind, exact normal ranges can vary slightly depending on your specific age and the laboratory doing the analysis. A doctor is looking at your lab trends over time, not just a single snapshot. An excellent number for a 65-year-old might look a bit different than an excellent number for a 25-year-old. Clinical context matters so much.
But here is the most critical piece of information when decoding those results. The American Urological Association states that a testosterone level below 300 nanograms per deciliter, along with symptoms, is used to diagnose testosterone deficiency. Did you catch that? Along with symptoms. Doctors combine the lab numbers with the actual physical symptoms you're experiencing. A low number all by itself, without any symptoms, does not mean you have a deficiency that requires medical intervention. You aren't just treating a number on a page.
Section 5. Treatment and Natural Approaches. What exactly happens after a medical professional confirms a diagnosis?
Before jumping straight into medication, a very common question always pops up. If you're sitting there wondering if you can fix a mild issue naturally, the medical guidelines suggest that yes, lifestyle interventions should often be the very first step, especially for mild cases.
For men with a mild deficiency, the recommended lifestyle modifications include maintaining a healthy weight, losing excess body fat, and increasing regular exercise. But why does this work? It's fascinating. Fat cells contain an enzyme called aromatase, which literally converts your testosterone into estrogen. So dropping excess body fat actively stops this conversion process. Often, just consistent exercise and weight management can naturally boost those hormone levels back into a healthy range without needing medical therapies.
So, the crucial point is, what if lifestyle changes just aren't enough? Doctors can prescribe treatments like topical gels, patches, or injections to restore levels. However, it's really important to note that the FDA has issued strict cautions regarding cardiovascular risks. Therapy can raise blood pressure and potentially increase the risk of heart attacks and stroke. Furthermore, the golden rule here is that unnecessary supplementation for men who already have normal levels is not a magic fix for strength or virility, it is actively harmful.
Finally, Section 6. Next steps and specialists. Where do you go from here? Knowing who to see is half the battle. Navigating the healthcare system can be tricky, which is why starting with your primary care doctor acts as the perfect quarterback for your care. They can order the initial morning blood tests and evaluate your overall health. From there, they might refer you to a specialist. An endocrinologist specializes in hormones and handles complex cases for both men and women. A urologist is an expert in the male reproductive system and is well-equipped for male hypogonadism. For women dealing with symptoms of high testosterone, like irregular periods or suspected PCOS, a gynecologist is a crucial specialist to consult. I want to leave you with this provocative thought to wrap up. Are you treating a real symptom or just chasing a number? Remember, this explainer is strictly educational. It is incredibly easy to get caught up in the marketing hype and try to self-diagnose based on the vague feeling of fatigue, but hormonal health requires real medical precision. Always consult a qualified healthcare provider for a proper clinical evaluation. Thanks for joining me on this explainer, and keep asking the right questions about your health.